Okay, our next group of points are the called penetrating points, or Tung. Tong points. We have the penetrating gate, penetrating mountain, and penetrating heaven. 8801, 8802, and 8803 in Dung system. They are located 5, 7, and 9 sun proximal to the patella, the anterior aspect of the patella, that is. These particular points are good for heart disease, pain in the heart area, dizziness and vertigo, and of course including some of these heart conditions, palpitations, hypertension, and circulation. These particular points are considerably shallow in that they're approximately a ½ inch deep, not deeper than 1 sun. I say that because there's lots of tissue here, so for the amount of tissue it's not incredibly deep. ½ sun to 1 sun deep. And the intervention is with the cardiac nerve of the anterior thigh. So this certainly makes interesting sense. Futu, stomach 32, is certainly included in this collection, and its job, of course, is to regulate the blood, therefore good for circulation. This channel is between the stomach and the spleen, a common channels shared for Master Dung's points. So first we're going to find Tong Guan. Tong Guan is 8801, penetrating gate. This point is similar to Guan, P6. So we're going to go 5 sun above. Again, this is on the midline, so we want to check because the angle of the leg often will tip outwards. The foot will tip outwards. So it might not seem straight up in the air. Imperative that we go directly in the midline. And each point here is 2 sun above. So checking my midline again, up against the patella. So there we have the penetrating points. Penetrating gate, mountain, and heaven. 5 sun and then 2 between. Primarily for issues relating to cardiovascular, circulation, and also dizziness, vertigo. Again, these points can also be needle freehand, but for the sake of the video, I'm using a tube, and oftentimes I use a tube for these. Two sun above, checking your midline once again, perpendicular. Best you can. Sometimes if I see something out of line at the end, I will go back and lift it and adjust, make the adjustment. And these are 30 millimeters, and as you can see, they're relatively buried here. And because there is a lot of tissue here, I tend to take this for cardiovascular issues down to that level. So there we have it, 8801, 8802, and 8803. The passing points.